inga. A whai e ni poto fale. Whaonga se poto e tele whamalama. Pea tala whea ngai fōi, whaonga se whale ui e se mai whale ui e whaonga le ainga atoa. Whaatala noa se tasi whawha atua le li o loa ainga. Ina ia whaawhaingo whia ai wana maua maini wa ainga tā ua e mana o mia i aso uma. Ia whailo o fifofonga i taimi uma. Tau mamau ma ila atua a fia, ma tau sile wā mamau whaatulanga ina. Fufulu mama lima a ole i tango fia mata, isu, malingutu. Fufulu mama lima i se fasi moli ma se vai mama, pe whaonga fo i se whangu waila au. Fufulu ma wha mama vaenga le whale ma sio sio manga o tango fia i taimi uma. Manatua, a whai a wha anu fo e sea ui, e tā ua le mata i tū pea i aunga o le wha mai. Whaonga a wala o whasota inga wha pea le interneti, e whasota i atuai i a inga moro. Bili le lua tasi iwa malongo le soifo maloloina i le tūlanga o iailo ngase maloa a fianga.
Fatu ilo whafonga Mrik Samoa, tai au manuia, tai au tutoa i le alofa ma le anga le lei o le tua. O tō pa ia ma mamalu, pa ia whale atunuu, mamalu whale malo, ia e mese o pa ia whale tala le lei o te whatulo atu. Nunu atu ia whatino tau sala o tō pa ia o le ale o iai se whamtalanga le au auna, ia awa o te le ngā whatia. Ai tau ona mamoli atu e alofa anga mwhawhewha i atu i nei tai au fōu tātou au lia i le alofa ma le anga le lei o le atua. Good morning, American Samoa. It is an honor to be here with you again as part of our weekly updates to provide you the latest information on how your government is doing in order to treat and respond to the surge of COVID in American Samoa. Laso le nei, ia o le a tuatu foi se whaupoponga al tātou komiti, ia a wānga luenga o lo whiangai ma le tātou whainga malo, ia a wāle tūlanga o le Kvzktv wa fia iso tātou motu nei tutuila. O le tala fia, e o mai le temi nei, e le o whaamaonia, le pepesi o le nei whaamai, i lo tātou motu i manua. O le tūlanga lea o lo ngā lulua e pēa, le fionga i le whātonu, ina ia malu puipuia o le tātou i tū mālo i manua, ina nei awane i a whaina i le nei whamai, ia ua tātou whiangai e nei tutuila. Pe ona mā ua pēa i a whamatalanga, i tūlanga o le nei whamai, ia e pe o lea ua mau ese mai tātou matulanga sa iaile mawalunga o le whamai i le vaiaso wa tuanai. Le vaiaso o tuanai sa whai lava sina mawalunga o numera o nā fia. O le nei wo o mai le vaiaso le nei whatua umatu nei. Ia ua fōlinga mai wa sau i lalua tātou numera. Sau si temi o na sau nuatu la ia o le Fomai a lauvao, e whamatala i ili tūlanga o le tātou surge. I want to welcome everyone to this press conference this morning. Another update of how we are doing. Last week we saw our positive numbers come down to an daily average of 174. That compares to the week before, where we had a daily average of about 250, 248. So this is definitely, we hope, it's a positive trend for us to show that the surge is starting to wane and then we can hopefully be rid with this surge quickly. Dr. Laval will speak to the implications of these numbers to American Samoa, as it was shared in other press conferences. We expected the peak to happen this last week and the week before. It appears that our peak happened the week before, based on the numbers. And so we are thankful that our numbers are starting to come down. As was projected, the surge in cases of critical cases and fatalities are likely to happen 1 to 2 weeks after our surge. And so far, that seems to be the case. As we move away, hopefully, from the surge, our focus now, the government's focus now is with our LBJ and our hospital, so that they are prepared to handle the expected surge of critical cases that will be coming into LBJ. So at our press conference today, Dr. Ledua, speaking on behalf of LBJ, will update you on the preparations that our hospital has been doing to be able to handle the expected surge of cases. Also today, we will hear from our FEMA and our federal partners with the work that they are doing today. Allison Flander and another member of our federal team who might want to present today. They will give you their assessment of the situation American Samoa is with the surge. But that is what we hope to present to you today. And when we're done with the presentations by DOH, LBJ, and FEMA, and our federal partners, we will open the floor to our media partners for any questions. And after that, we will close our presentation today. So without further ado, I'd like to give the opportunity now to Director Nua and the Department of Health for your presentation. Thank you.
Mua whātaro whātu lower foi le paia ma le manu o tonu le nau maurunga mapua e tūlanga nei tai au e tūsai foi ma le lenga alana fionga le ai whātu lower tuai le nei tai au tūsai foi ma nei foi tūlau tātou whailoa iai. Good morning, ladies and gentlemen. This is the headquarters of Public Health, DOH, reporting from our headquarters in Tafuna. In a moment, I will turn the floor over to Dr. Laval and her epidemiology team for a quick presentation in regard to what's going on in American Samoa, the status of our COVID-19, and also the way ahead next week. And I will make some final comments, and we will be there to answer some questions. Right now, I'm going to turn the floor over to Dr. Laval and her team, American Samoa. Over. Dr. Laval.
Thank you, Director Nua. Good morning, Gar, and the rest of the participants and all the task force members and our media, federal partners. This is the situation report from DOH as of the last 24 hours. First slide. Next slide. This is a quick snapshot of our response activities from yesterday, April 3rd, 2022. DOH clinics are closed on Sunday. Only LBJ was conducting testing yesterday, with a total number of 153 tests conducted by LBJ Hospital and EMS. We continue to see a decrease in the number of our daily tests. This is also aligned with a decrease in the number of daily positive cases, with 26 confirmed positive cases in the past 24 hours, compared to the data from last Sunday, where there were 32 confirmed cases, now only 26 positive cases, which is about 20% less from the last Sunday. This decrease in positive cases also seen at our DOH clinics. We're also keeping an eye on those numbers, and hopefully we continue to see this downward curve of positive cases. DOH and LBJ also continue to offer treatments, therapeutic treatments for those who are tested positive with symptoms. We treated 26 patients yesterday. As far as treatment is concerned, one of our therapeutics, Retrovimab, is no longer available as a treatment option. FDA pulled the emergency use authorization for sotrovimab because it doesn't cover SARS-CoV Omicron variant BA2, which is now the most relevant and the most common variant in the region. But we're also, DOH also collecting samples, which will be sent to the Hawaii State Lab for genomic sequencing to find out if BA2 is circulating here in American Samoa. But evidence shows that we are still dealing with BA1 subvariant. There's one death reported from the last 24 hours. The LPJ will elaborate on that death during their presentation. Next slide. Looking at our cumulative counts as of April 3rd, 2022, with additional 26 cases in the past 24 hours, our cumulative for those who tested positive at one of our clinics, the LPJ, stands at 4,703 positive cases. Yesterday, 56 of those were tested positive, completed their 14 days of isolation, and are now deemed recovered. So a total of 1,581 have recovered. So the number of active cases out in the community is 3,116. I would like to mention that we are seeing a decline in the number of active cases compared to the previous day. Yesterday, we treated 26 individuals with total number of people being treated as 1,660. Once again, we'd like to urge the public, if you have any symptoms, feeling like flu-like symptoms, to please come into one of our clinics and get tested and assessed for treatment. This is how we reduce our chances of getting severe disease and death. Hospitalization and deaths, LBJ will elaborate on that, but yesterday, 1 death was recorded, bringing our total to 8 deaths associated with COVID-19 sickness. Next slide. This is a look at a number of cases distributed among our population by age group. Then the age group that's coming in to be tested, majority of our positive cases are from the 18 to 60 years old. This is consistent with our working group. And people are not just coming in to get tested because of symptoms, but we also are coming in to be tested for work-related policies. Good thing to see is the majority of our cases are fully vaccinated and protected from severe disease. Once again, we urge the public and our people to come in and get vaccinated, especially for those who are 50 years and older, to get their booster dose. Next slide. This is a quick looking at our positive cases and their vaccination and booster status. From the 26 positive cases in the past 24 hours, only 57.7% are fully vaccinated, and about 19.2% have not received a single dose. Looking at our overall or cumulative numbers, 84.9% of all positive cases have been fully vaccinated. This mirrors what we are seeing with the estimated total coverage of our COVID-19 vaccine in the territory. Among those who had boosters, only about 37.9% have received a booster shot. Once again, data from the U.S. suggests that booster shots significantly reduces our severe disease of someone becoming severely infected and ended up in a fatality. So we need to urge our people, the community, especially those who are 50 years and older, to come in and get their booster dose. Next slide. In order to track the progression of our COVID-19 outbreak, number of cases per village is presented here. We have a list of villages and number of cases from all those villages. But the map here on the right tells us the story. COVID-19 has canvassed the entire island of Tutuila and Aunu'u from west to east. As far as the distribution of COVID-19 cases, the darker the color of the village, the higher the number of cases from those villages. Most of our cases are among the villages with higher population, which include Tafuna, Nu'uli, Pango, Leone, and Baitongi. We are conducting tests in Manua, and after conducting 18 tests, there is still no evidence that COVID-19 has reached Manua. We are also testing passengers prior to flying to Manua. Anybody who tested positive will not be allowed to travel to Manua. Next slide. Again, this is a useful way to track the progression of our outbreak is our epicurve, the total number of cases per day and the 7-day case rate. The 7-day case rate take into account the number of cases and the total population as a ratio and multiplying by 100,000. This way, we can compare our ongoing outbreak with other countries or jurisdictions. By looking at our epicurve and 7-day case rate, it appears that we have reached and passed the peak of our outbreak, and that we are now in a downward trend. We hope to see this trend to continue in the coming weeks. Compared to last week, We are seeing less people coming in to get tested and subsequently less number of cases. This is why it's important for us to look at our positivity rate with a number of those testing positive compared to a total number of people getting tested for these days. Next slide. This chart shows our daily positive rate of all samples being tested at our DOH clinics and also LBJ. From the 24th of March until yesterday, April 3rd, we can see that there has been a decline in the proportion of samples that are testing positive. Hopefully, this trend will continue, signifying that we are heading towards the end of this outbreak. The next coming weeks will give us a better picture. Next slide. Although we are seeing the decline in number of cases and proportion of samples being tested positive, we still need to monitor LBJ hospital and especially our deaths. From around the world, data suggests that hospitalization deaths usually peaks around from 1 to 2 weeks after the number of cases peak. This means we are not in the clear with our LBJ hospital. We still need to make sure that our patients are being assessed for treatment and really need to identify those who need to be hospitalized and receive treatment from LBJ. DOH will work closely with LBJ in the next coming weeks to minimize deaths through early detection of those who need hospitalization. We all need to work together on this effort. With one recorded death yesterday, our case fatality proportion during this outbreak is at 0.5%. Case fatality proportion is calculated using 8 deaths as a proportion of total number of those who have recovered. Next slide. Next slide. This is our schedule for this week. We're keeping the same schedule from last week. One of our vaccination sites is at Tafuna Diwa, and those are the hours. Our testing sites remain to be at Amauli, Tafuna, and Leone Health Centers from 8 to 4 p.m. On Saturday, we will have one vaccination drive-through. It will be at Tafuna Airport, and also one testing site open on Saturday, which is Tafuna ACF1 from 8 to 2 p.m. Next slide. Next slide. Just looking at our testing inventory, majority of the tests that are being used at the testing sites are our Binex Now antigen test. However, we're also using other tests like Abbott ID Now and Ecula at our DOH clinics. We still have a good stock of tests on hand with about 800 tests a day. We have about 37 days of worth of our tests available at DOH. Next slide. Next slide. That's our vaccination drive from last week, Saturday at airport, market, and also from our homebound teams are going out to visit our homebound patients. A total number of doses that were given out on Saturday was 389. 316 out of 389 are all booster doses. Next slide. That's looking at our booster administered. Close to 60% of our population have already received their booster doses. Good thing is when we look at those who are 50 years and older, about 70% of that population have already received their booster dose. Next slide. Looking at our eligible population for vaccine, 5 years and older, about 91.7% are fully vaccinated, about 2.7% are awaiting their second dose, and 2.4% are way past their second dose. Next slide. This is our pie chart looking at the total population of our coverage. We're estimating about 83.4% are fully vaccinated and about 88.1% with at least one dose. We are still in pursuit of those who are passed with their second shot. Once their 21 days for Pfizer, 28 days Moderna is up, they are still qualified to come in for their second dose. We are currently discussing the role of the second booster dose that's being released from FDA on March 2022. We will update the task force after we have meetings to discuss the second booster shot for our community. Next slide. Here's a look at our vaccine coverage by our villages. We are seeing that it's a majority of our villages are in the light blue or dark blue, with a few of our villages who are in the green. So most of the villages are 75 to 90% coverage for vaccinations. Next slide. And that's the situation report from DOH for the last 24 hours. I yield my time back to Director Noor. Over.
Thank you, Dr. Laval. Could you please kind of comment a little bit more about the second test for our flight, last flight on the 31st, that would be tested tomorrow, Famole, then I'll close out.
Okay, for the March 31st to 2022 flight, Hawaiian Air flights, we're asking the passengers that tested negative and sent home to come to the airport. They require a second test at the airport drive-through on Tuesday, April 5th or Wednesday, April 6th. And those who are tested positive will be placed in isolation for another 14 days if they're tested positive at the airport. So April 5th and April 6th are the days for the drive-through testing for the March 31st Hawaiian Air flights. This testing is mandatory. Thank you.
Okay, thank you, Dr. Laval. And we will continue to work with the TCO, Office of the Homeland Security, and also our ASG agencies to support future flights, to include the one that's already been approved by Honorable Carr and the task force, 7th of April, coming up this coming Thursday, to improve our response to make sure our travelers coming to American Samoa will spend as little time at the airport as possible. We are also preparing to support the flight on the 14th of April 2022 and continue to improve our response at the airport. Today is DOH approved charter to Manua to transport more vaccines, more test kits, and also therapeutic in case they have a positive case in Manua. We do have 2 doctors in Manua, 2 LPNs, and 4 certified nurse assistants that are providing support to the Manua population. We're looking at continuing our homebound visit to those elderlies that are bedridden at home this Wednesday, Thursday, Friday, and Saturday. Or I believe it's Wednesday, Friday, and Saturday. I'm sorry. Wednesday, Friday, and Saturday. Let me see. And that's it from the DOH headquarters, Honorable Carr, and also member of the media. Thank you very much, and we stand by for questioning. Over. Kvzktv.
Thank you, Director Nua. Thank you, Dr. Laval, for your presentation. And yes, please stand by for questions. And now to Dr. Ledua and LBJ.
Good morning, American Samoa. Good morning, Honorable Carr, and members of the task force, members of the media, our federal partners. This is the briefing from LBJ Medical Center over the last 24 to 48 hours. For the last 24 hours, we had 153 tests conducted at LBJ Medical Center, which was the only center that was open for testing yesterday. Out of that 153, we had 26 cases, positive cases. In terms of treatment, 27 patients received treatment, and this includes patients who are already admitted in the hospital. As of this morning, we have 27 patients admitted in the hospital for COVID. 3 of them are admitted in the COVID ward, and 24 are admitted in the COVID cohort ward. There has been no admission over the last 24 hours, but over the last 48 hours, we have had 3 admissions. The 3 admissions were, 2 of them were children that were not eligible for vaccination, 1-year-old and a 3-year-old who were siblings. They were presented with mild symptoms of COVID, and they are doing well. They're most likely going to be discharged today. The 3rd admission was a 74-year-old male who was fully vaccinated, and he was admitted for other medical problems, but because he was tested positive for COVID, he was admitted and treated for both his medical illness and also for his COVID. One thing that we have seen and realized in the last 48 hours was the number of patients who have been seen and treated happened on Saturday, and one happened yesterday, early this morning. This is an important information to know, because as we know, follow the doctor's advice and to be admitted, because you may feel well, you may feel better after the initial treatment, but things can rapidly progress. That is one of the things that we have seen and highlighted in the last 48 hours of the high number of patients who are supposed to be admitted, but they have signed against medical advice and they preferred to go home. And we have worked with the family to try and get them on a daily basis to report for treatment, for the treatment that they're supposed to receive over the course of their COVID illness. Over the last 48 hours, we have had one death, and the death is a 64-year-old female who has 2 doses of vaccines. She was admitted on the 22nd of March, and she died on the 2nd of April. So she was admitted in our hospital for about 1.5 weeks before she died. The reason of her admission was because of a heart attack that she had. She also had a lot of comorbid conditions, and she was tested positive, and the reason for her to be admitted to the COVID ward. Next slide, please. In terms of our preparation, we are preparing for the COVID surge to our hospital. In our hospital, in preparation, we have prepared our infrastructure, our bed space. As of now, we have 51 beds available in our hospital to cater for any surge that might occur. As of now, our average bed occupancy has been 28 to 30 at any one time, and we have prepared 51 beds for any surge. This is excluding our behavioral health unit, which has another 10 beds, and we will be working in the next few days to try and prepare these beds to be ready, which will add onto our bed count number to 61 by the end of this week to prepare for any surge. We have also got our support services in terms of staffing from the New West group. We had 14 of these members who arrived 2 days ago, and they were welcomed to LBJ Hospital yesterday, and some of them started their shift last night in the respective areas that they were working in. 14 of them arrived. Out of them 14, 10 of them were nurses, and 4 were respiratory therapists. We are also expecting to get the rest of this group on this Thursday flight to reinforce the number and the staffing that we have to take care of our inpatients. In addition to that New West group, we also have 3 of our physicians who will be traveling with the group on Thursday, and these physicians will add onto the numbers of staffing that we have to take care of our inpatients. All the facilities that we have and the rooms that we have HEPA air filters installed that will allow filtration of air, input of fresh air, and removal of air inside the tents out into the outside of the tent. Those are the preparation that we have. I would like to assure the public that our hospital, we are ready, to take care of any surge that we have in the next few days, and we have enough space and adequate space. We targeted 50 beds, and we have 51 beds right now. In addition to that, we are preparing an extra 10 beds, and we are working together with our partners, Department of Health, our American Samoan government and agencies, and together with our federal partners to prepare for any surge to take care of you. That is all from LBJ, and I will be open for any questions after this. Thank you.
Thank you, Dr. Ladua, and the team at LBJ for all the great work that you are doing, serving our people and preparing for the expected surge. And now I'll turn the floor over to Allison Flander and an update from our federal partners who are helping us with our surge.
Hello, the Honorable Lieutenant Governor, Honorable American Samoa government officials, and the American Samoa community. The government, community leaders, and the public have worked hard over the past 2 years and continue to support this COVID-19 surge we're experiencing over the last couple months to keep American Samoa safe. As DOH and LBJ presented today, we've seen a trend down in the COVID positive cases, but we've seen a trend up in the hospitalizations. I wanted to take a moment to say that my heart continues to go out to the families who have lost their loved ones due to COVID-related reasons. The folks being hospitalized in this increase in hospitalizations are experiencing lesser impacts of Omicron variant due to the therapies being provided. So I just wanted to let the public know that there is, in fact, those therapy sites, as DOH mentioned, and they're co-located with the COVID testing sites. And you can go to Tafuna, Amauli, LBJ, and Leone to get tested and to get treated to help support you in not ending up in the hospital, ideally. Over the past week, the federal team has brought on additional folks to support the mission, and I want to briefly update you on the actions the federal team has taken in this past week. A flight supported by the DoD arrived Saturday, bringing 2 HHS leaders, including Commander Ed Kua, who will speak following me, and LBJ contract support. These folks will be providing additional assistance to the hospital. And as a point of clarification, the newest contractors with LBJ are not FEMA contractors. However, they are supporting the LBJ hospitalization surge on behalf of LBJ. On Thursday, we'll receive another flight of 17 new public health service officers who will be replacing the outgoing 19 Public Health Service Commission Corps officers. The HHS Health and Medical Task Force will also be leaving on Thursday, but LBJ is in good hands with their contracted medical personnel who arrived this past Saturday, with additional staff arriving this Thursday. FEMA and federal partners are continuing to support American Samoa on vaccinations, administering therapies, supporting LBJ with medical support, and assisting the LBJ hospital with their expansion project. We've brought on the CDC epidemiologist, Dr. Thane Hancock, logical support to DOH and the American Samoa government. The U.S. Army Corps of Engineers continues to provide technical assistance on the LBJ conversion project. This is a continuation of their previous assessment when they were on the ground. The Health and Medical Task Force continues to support LBJ's COVID surge, and they are transitioning their knowledge of the LBJ hospitalization processes and procedures to the contractors that arrived this past week. The medical response team of PHS officers, public health service officers, continue to augment the Department of Health staff at the Tafuna Diwa site, the Leone Health Center, and the Amauli Health Center to provide vaccinations to those that are requiring their first, second, or booster dose. They also continue to support the Department of Health at the testing and therapeutic sites in Tafuna, Leone, and Amauli, where they're assisting COVID patients to understand their therapeutic options and administering those therapies to individuals. On a cargo flight that arrived on Saturday, more than 2,500 therapies arrived, and this will help support 2,500 people who may require treatment from COVID-19. And I would also be remiss to say that the Veteran Affairs here in American Samoa has been supporting the vaccination sites, primarily at the drive-through vaccinations on Saturdays. However, you might see them at the other vaccination locations, and we appreciate their support. We continue to urge the support and to increase the therapies that are being administered. Over the course of the time that we've been here, we've vaccinated over 9,000 people and provided therapies to approximately 1,200 people. As I mentioned previously, it's very important to conduct those preventative measures, and that is, social distancing, masking, as well as receiving the first, second dose of the vaccine and the booster, which will help you protect you against the Omicron variant. So if you haven't had a chance to go out and get those vaccines, please do go to one of those vaccination sites, as well as you may receive support from the homebound mission that the Department of Health has been operating. Additionally, I will say, if you do test positive or you believe that you are positive for COVID, please go to one of the testing sites and you can receive those therapies. It's been a pleasure to work alongside our American Samoa government counterparts to support the American Samoa people. Thank you for your time. Whakatai lava. And now I will turn it over to Commander Ed Kua to provide some remarks from HHS.
Thank you, Allison, and good morning, Honorable Lieutenant Governor, and ladies and gentlemen of the American Samoa government and the people of American Samoa. First of all, I'd like to thank all of you for welcoming me back to American Samoa. It's one of my favorite places in the region that we serve through HHS. I haven't been here since 2019. It's good to be back. One thing I wanted to mention about that is I really wanted to give credit to the leadership that kept American Samoa COVID-free for so long. And as we pivot over to keeping American Samoa COVID safe and really fortifying the hospitals in order to absorb the surge, as well as keeping people safe even after the surge. I think that gave us a lot of time here in American Samoa to be able to benefit from many of the lessons we learned from public health and medical lessons from all the other jurisdictions that we've dealt with COVID-19. One of those things I wanted to emphasize is I had the opportunity to really work very closely with our Department of Health and our LBJ hospital leadership through the regional folks at HHS Asper. I got a chance to walk through yesterday LBJ, and I feel confident that the team there, along with our federal support, is really ready to care for anyone who comes down with COVID-19. In addition to that, there are a few things that we could do before people have to go to the hospital and receive care. Like Allison said earlier, you can get vaccinated. If you're eligible for a booster, please go get your booster. If you are eligible for one of the therapeutics, please comply and listen to your medical professionals here and follow on with that care. And then lastly, if you do end up in the hospital, we're very comfortable and confident that you have the best medical professionals who can care for you and get you through. With that said, I wanted to emphasize that it really has been a pleasure for me to be back here in American Samoa and be able to help your people through this surge. I speak on behalf of all our federal responders on the medical side who just feel very proud to be here. With that, I'll defer my time back to you, Allison. Thank you.
Thank you, Commander Kua.
Thank you, Commander Kua, and welcome back to American Samoa. We are looking forward to working with you and your team to move us forward, especially with the work. A couple of things before I turn the floor over to our media partners. The March 31st flight, the folks that came in, Dr. Lavao has just stated we have required testing for you starting tomorrow. There's going to be a group coming in tomorrow, and then on the following day, on Wednesday, due to your excitement of going home, forgot to provide your travel document by the attorney. Travel document, Fiumai la sotolsuta siumati, Ia tautua nā a fio mai le aso tae au po le aso lulu e whaile suenga ia ma au mai tato passport se I sila iai le fionga le loia sili ma wha maonia lo to ai tau nuu mai lo tato atunuu. Also wanted to remind folks on the March 31st flight that you're supposed to check in daily on Talofa Pass. It's critical for us to know and confirm that you're abiding by the terms of your quarantine to stay home and not roam around and potentially get infected. Peon sila fia tato atunu o lewa yel tato valele o whapopo mo le vaiaso nei la stofi. Ia talsanga atu tato atunu a whai yei nisi o ainga o lo fia whai malanga mai I le valele le tato la sofitu o lo tele lava va no le va. Ia fa sota e o tato ainga o lo I Hawaii mafafu. Le o leo lo mo pele va no e whai ona le stala. Ia ma fio mai le vaa lea tātou o le aso fitu. O le vaa lea ua talai foi le requirement lea e tauna le stala I le sulfa aso. Ai tāua o na asiasiai, le malu la tunu ua lewa na fia toi foi mai la tunu. Ia o le sia vanoa lea ua foi mai le company o le Hawaii and Air. E mawhai e ona whai malanga mai o tātou tunu I Amerika Samoa. So please, on the April 7th flight, we have a lot of openings there. Folks who want to return home, who have been stuck in Hawaii and the mainland, this is the opportunity to come back. We are waiving the requirement of the 14-day sign-up or registration. You just need to make sure you get the required tests and that you register on Talofa Pass before you get on the flight. O le tulanga o le tato fasili o lewa o mai a fasili a le tato ofisa mai le KHJ le atu mumu atu le vanoa ia fili ia o le vanoa le whaimaini o fasili.
Good morning, Lieutenant Governor Famul Morilava. As the number of fatalities starting to go up, and condolence to the family, if by any chance, Lieutenant Governor or Ms. Allison could speak a little bit more to inform people of the funeral assistance program that FEMA offers for this kind of fatality, please.
Go ahead, Allison.
Absolutely. So FEMA does have a COVID-19 funeral assistance program for any member who has lost their loved one. The process is relatively simple. You have to call into the COVID-19 funeral assistance, and the hours of operation, for everyone's knowledge, so they do close at 2 p.m., who will walk you through various question sets. And it takes about 15 to 20 minutes to go through that process. They will require some documentation regarding the official death certificate that shows that the death occurred either in the United States, in any of the territories, or the District of Columbia. And so the process is those who require assistance putting through this application. They are going to support you in whatever way that you need to ensure that this application comes through. So again, the number to call for the funeral assistance helpline is 844-684-6333. Thank you.
Thank you very much. And my last questions, please, is for the Health Department. On the March 31st flight, could you confirm the actual number of positive cases? Are those individuals tested positive in isolation, or they went home?
Thank you, Philly, for the question. Those who were tested positive from the March 31st flight, there were 2 tested positive on the night of the arrival of the flight, and those individuals are isolated at Tafuna ACF2.
Any new positives from those individuals? Was it a family, please, who traveled together?
So they were tested again on Friday. over the weekend, and 2 of them. So the total number of people are positive at ACF2 is 4. Over.
Thank you very much. Have a nice day.
Thank you.
Thank you, Philly. The issue of the funeral assistance, Allison has just given our the help the helpline number. So for those folks who are able to go through that that route, please proceed accordingly. The Department of Homeland Security, TEMCO, also has agents standing ready to provide assistance to our folks who would prefer to have our local department access and get their papers in order for the funeral assistance. So I have 3 questions from our folks, our friends at KHJ. The first question, I'll just read it out. Reading posting on Talanay and elsewhere about the 7, now 8 deaths. People seem to think that vaccinations didn't prevent their deaths, as health authorities have been saying. What does medical experts counter such opinions? Let me give this question to Dr. Ledua first, and then maybe Dr. Laval next.
Thank you, Honorable Gar. You know, as you have heard, in all of the cases that I presented that have died, you know, over the last couple of weeks, all of these deaths have multiple comorbidities, and the comorbidities ranges from you know, from heart attack to chronic kidney failure that requires dialysis and has been going on for years, complications of diabetes and hypertension. You know, as I said, most of these deaths are mainly attributed to those comorbid conditions. And because these people are tested positive with COVID, you know, their death is regarded as a COVID-related death, but the main cause of death are the comorbid conditions that they have.
Thank you, Dr. Ledua. Dr. Laval?
Thank you, Gar. We just want to encourage the community that it is being studied and also be known that in order to prevent for COVID-19 severe infection and fatality is to be fully vaccinated and have a booster dose. It's been proven in so many studies for this one to get vaccinated and booster dose to prevent any severe infection and fatality. Thank you.
I'd like to give the opportunity to our federal partners who may want to rein in on this question.
Yes, absolutely. I'm actually going to pass this over to Commander Kua to respond from the health perspective.
Thank you.
Thank you. And I would just kind of echo what Dr. Laval said there, that, yeah, if you can help it, get vaccinated. And if you're eligible for a booster, get yourself a booster. And then with that, really as much as possible, try to maintain your social distancing, especially around folks that you are unaware of their vaccination status, and still avoid those larger type gatherings. Those are the things that you're able to do. Wear a mask when you can, wash your hands frequently. Those type of measures that you could keep yourself protected from. And then also what Dr. Ledua mentioned, those reports of COVID deaths, really, they happen to have COVID, but also it really could have very well been those comorbidities that really brought them to the end there. So it's unfortunate that it's captured that way, but you know, there are some things that we could do to kind of maintain our safety with the COVID part of it. But I echo the message by the 2 medical professionals. Thank you.
Okay, thank you, Commander Kua, Dr. Laval, and Dr. Ledua for answering that question. Ultimately, the evidence and the report that we've seen all points to having vaccination, the booster, and having the treatments within the 10-day period are critical to saving lives. So I'd like to ask our community to please keep that in mind and encourage our local residents to come in and get those done. The second question from KHJ asked whether the projections or the predictions of the COVID spread are panning out. The epic curve that was discussed probably in the first or second week, once we started getting the numbers in with the projections of when the peak is going to be and when we're going to start to go down, have for the most part, and you've all have seen the results. So the most part have been on point. We had predicted our peak to happen last week, the week of the 28th through April 3rd. And at least based on the numbers we've seen so far, it appears that our peak was the week before, the week of Monday the 21st, ending on the 27th, because we started seeing those numbers coming down. Now, we still need to wait to see what the rest of the numbers of this week look like in order to make a final conclusion. But in terms of the positivity rate and the number of people coming in to get tested, those are all appear to be in line with the projections of the epidemiologists that have looked at this. And the reason why we use these projections is because it informs the planning of the government. So once this thing happened, once we got community spread, the playbook was to expand the vaccination and have testing and treatment available to as many people as we can, knowing that as the numbers continue to increase, we will reach a peak point. And then once that peak point happens, the lessons from other jurisdictions is that 1 to 2 weeks after the peak, then we start to see the bump in critical cases. And we're following the same example. We're following the same plan with the assistance of our federal partners, FEMA and HHS. We believe and we hope that we're now done with our peak, and so now we're pivoting to focus into our hospital, to making sure that our hospital has the capacity to handle these cases. So, and again, these projections are just projections, and as the more numbers that we come in as a statistical exercise, the better the ability to predict and to project. And so we're grateful and thankful to the assistance of our federal partners, because they provide the resources that allow us to map these things out and get a better idea of what's happening. And that's why the situation with Manua is critical, and the reason why we're taking the approach we're taking to basically keep Manua safe from us, because we don't want a surge to happen in Manua when we're dealing with the surge here. So I know that folks in Manua are disappointed because they're not able to travel back and forth, but that's one of the key reasons. As Commander Kua mentioned, we learned a lot during the last 2 years while the U.S. was going through surge after surge. And so all of that experience that Commander Kua and Allison have learned from other jurisdictions that went through surges, they're bringing those here to American Samoa, and they are informing our ability to use resources, to use them wisely. It informs our decision on the type of lockdown that we want to have. So all of those things are in play, and I want to thank our community for bearing with us, but do feel comforted that there is a plan in place. It may not seem like there is order here, but we are trying the best that we can to guide us through this very difficult time. Okay, the third question from KHJ, I'll just read it. It's a long question. For the public's information, can they include in their press releases the lists of previously prohibited businesses that are now allowed to open? Why not just open everything else up? I mean, is there a medical justification to keeping certain businesses closed when they have opened nearly everything up, including funerals and church services without strict monitoring? We do have a list of prohibited businesses, and in the governor's declaration, there's also a process for businesses and these activities to apply in order to be given permission to operate. So as long as the business comes in and provides the plan on how they want to open up their business, and the prohibited businesses are those that involve close contact, things like getting haircuts and massage parlors, and those type of businesses. From the advice of the medical community, they are concerned that these types of business may further the spread of the virus, and so that's why the task force has decided to put some restrictions in place so that we have some assurance that people are acting reasonably and trying to help us limit the spread of COVID. So businesses are encouraged to submit a request along with a plan on how you plan to open your business, open your massage parlor or whatever it is, and then give some time to the task force and the Department of Health to review the plan, and then they'll call you and come have a visit at your location and walk through and make sure that everything is in order. Once that is done, you will sit down with the task force, with the Department of Health and Department of Homeland Security, and draw up the final plan on how you open your business, whether it's a health center, a haircut place, or a massage parlor. And then you'll be allowed to open. The final step is a certificate. You'll get a certificate from the Director of Health allowing you to open your store, your business, and then you'll open, and the idea is that you will abide by the requirements. There will be unannounced visits to your place of business, and if you are found not to be in compliance with these requirements, then you will be required to close. As we do with all steps in this response, we rely on the advice of our medical community, and that is the reason why we are requiring these types of businesses to prepare the appropriate plans so that we can allow them to open. Funerals are allowed to operate as long as they follow their requirements, 10 inside, 20 outside. Funerals must be done within 4 hours. Church services are not prohibited so long as the church services are allowed to have only 10 indoors and 20 outdoors. So, as I had mentioned in other press conferences, the idea of us moving from COVID zero to COVID safe, learning to live with COVID, the whole thing only works if we all abide by a code of trust, of self-responsibility. There are not enough employees of the government to go out and manage and regulate every single business and every single funeral in this island. There's not enough. So we will set the requirements, set the rules, and we will rely on you, the people of American Samoa, to act like good citizens. You, the business owner, to act like a good business owner. make sure that your business is open safely and that you abide by the requirements. I encourage all businesses to please, people who are in this prohibited business category, to please come in, submit your plan, work with us. We want you to open your business, because once you open your business, that means more opportunities for our people to get your services, more opportunities for our government to get tax revenue. So it's not that we are trying to stop businesses from operating. I want all businesses to operate, but to operate safely. And the reason why we're treating you differently is because your services require the closeness in order to happen, and that's, as you all know, COVID spreads by close contact, but there are ways around it. You know, if people wear masks, wear gloves, people are vaccinated, then there is comfort in the government that you can open your business safely, and as long as we do that, we should be okay. Okay, are there any other questions from our friends at KHJ? I've just answered 3 of your questions.
Gar, I had a quick question.
Go ahead, John.
For you, if not for you, for Department of Education. Does it look at all like school might go back in session for the final month of the academic year? We're looking at May and June or whatever the calendar is that calls for the last day. Is there any chance that teachers will be asked to go back into the classroom for public schools?
John, I can answer that question.
Okay, go ahead, Gar.
The DOE is continuing to look at their plans. Most of their planning will have to rely on the numbers of our surge and the situation here. The hope of the government is to have schools resume. The hope of the governor and myself is to reopen schools. But all that has to be done in a safe way that protects not only our teachers and our students, and we have to rely on the advice of our medical community, especially our epidemiologists, both here locally and through the CDC. And that's why we are encouraging the schools in Manua to operate, because the mind of a child is a terrible thing to waste. And even here, the DOE, which is, like I said, a very terrible, terrible thing to happen. Okay, any other questions from KHJ? All right, KVCK, do you have any questions? KHJ, KVCK, Tosi? Okay, any other questions from our media partners before we close?
Samoa News is fine, sir. Thank you.
All good here from KHJ. Thanks again, Gar.
All right. Wanted to remind everyone that the Attorney General, Fainu Lei, is leading a team, a panel that has weekly or bi-weekly discussions over the KVCK and on our radio. So please tune in for that. That's another opportunity for our community to learn about current information about what's happening in our response. Whamanatu le malo tātou atu nuu, ia le folasanga o lo whaia pēr le fionga le loia sili, malana komiti whapitoa, ia o lo mau atu I le lunga I le ala ea, ia mesio KVCK, ia whatala noa ia tūlanga o le tātou whianga iai ma le tātou COVID-19 ma le iwa. Ia, Amerika Samoa, o se whamtalanga le nā, se taumwhainga fwoi a lau whainga malo, ia wale tātou whianga iei ma le nei whamai oti, whamai matu ia, mo le tupea malu I puenga, I le mamalu le tunu a whai wa iai se pati wa sala, rei foi se whamtalanga wa le tau tamali I lau whaafonga anga, a wale tau tua lau whai ngā malo, ia malua vei fale I o tō whina ngalo. O le nganga whawhitai atuai le mamalu le tunu, I la o tō tapua inga le mwai, I asu taitasi, ia wale whianga iai o le whionga le kovana, ma le mamalu le whai ngā malo, I le tātou fuafuanga mo le nei whaamai. Lofa le tua, le malu pui pui a pea I tātou uma o tātou whianga iai, ma I tātou maua pea lona while mu, I tātou te whaia inga luenga, a wale pui pui inga o le tātou atunu. Te mili nei, wala a watu lau a whionga le maputasi, ia mo sau noanga, po stima inga fo I whatama, ia I wha umai lo tātou aso, I le nei tū la. O whionga le maputasi,
Fongaku le whionga le kia kovanga le whio fo kara. Ia I kup mai ko uri le kapa mo. Mama le fo le fonga fai kula fonga le whionga le skenge. Ma le mo le whionga le fonga fikalai. Ia sui filia kuile mo. Le whionga fo le pamsimusili ma ba ela pamsimonga. Ia ka kolunga ka kumalo. Ele ko se lilo o lo ngo mo bea le whainga renga le kua. Mai le ka le sia ma le ka le sia. A wasi mo ngwe kuile mo. Ei, leo ka ko vai, le mogi ma fa maongi o le kua. Ia ka ko, I ula mo ka whiangai ma fa mai. E leo ku la fa inga ka ko le kua. E ngā ia whapepea le mo, kuile mongoa, on sai. Ia, o le mea ka ua, ngā ua, le o, ia se maa le furia. Le ngā, o whianga ko vanga ma le lukian ko vanga, le mesfua ni ngai task force, ia mesfua whatonu ia, mo tusa, ia, ka manga malako uma, heo foi le, whionga wha. Ale komsinga ma vaenga leo, le whionga foi le lo iesi. Le ai lawa se maa ele o kam. Leo ngā aina pe leo furia, a wān wha ma moere, mo. O upua e kusi whai mai, a wha inga loa, malama. A tako malama ko koroa, ia mo lola I o le kuia, a koroa I e whai. Ulanga ngā o kua koi whaka.
Halo lava, ato.
Ai mo wia kulanga o ka kuaso, mo wia foi kulanga o ka painga la ko o kangi mayala. Ka ko lo ye ya inga, ka man ki ngā mahalo mo whangau. Onga o kulanga, o lauinga I kulanga o nge whabai. Ia o umu ka pepenga le kua me umalava, mesi le ole whapau e su. Ia me lo kele. Ia wha mese le kua ia ki o kou, lango ainga, ka maam ki ngā halo mo whanau, e mese le kua o ngā pimi whapenga, ia I manguia ka kuasa, kuia mua, ia manguia Amerika foi. Thank you for our medical team, our Allison, and all of you people from the state. Oh, we don't have enough words to express our gratitude and our thank you. We know that you have your own family and your loved ones, your children back home, and you left them to come here and help the people of America and Samoa. Like the governor and the lieutenant governor said, thank you very much. God bless America and God bless America and Samoa. Thank you.
ia, soifua ia.